Hi, good afternoon everyone. Welcome to Alvernia Live Chat. So now we're live on TikTok, Facebook and also Instagram. I'm Dr. Zhu, I'm from 24-hour Urgent Care Center from this hospital. So today we'll be talking about falls and what to do within the first 30 minutes. Welcome to join us and feel free to drop any questions. And let me first start with introduction about myself. So I'm Dr. Zhu, I'm a general physician and I graduated in 2008. So I've been doing A&E and also doing general physician work for the past 6 to 8 years. Before that I was doing anesthesia training and I did rotation in ICU as well as anesthesia OT work and also general work in internal medicine and general surgery and pediatrics. So all these actually helped me in terms of gaining more experience and knowledge in working A&E. So falls is a very common topic we see in A&E day in and day out, unfortunately. So there are two main age groups. Number one is the children. So the other group is mainly the elderly lah. Yeah, but it can happen to anyone. So whether you're a parent or whether you're a caregiver for elderly family member, or you just want to get prepared in case there's anything accident happen, you want to help, it's good to join this chat and gain some useful knowledge. Yeah. So while waiting for the questions, I'll just maybe talk about general knowledge about falls. I'll basically group it into two kinds of falls. One is falls from intrinsic causes and the other one is from extrinsic causes. So hope everyone is following me now. Alright, so let's talk about extrinsic causes first because it's more common. For young children, it's mainly more from extrinsic falls. What do I mean by extrinsic? Meaning it's more from external factors. Okay, so it usually happens because of accident and it can be prevented. That's the most important thing. So safe-proofing your home is very important. So how do they fall? They can fall from just running on the ground and because of slip and fall, or they can actually fall because, for example, they were on the bed and then accidentally they actually fell off the bed because they're not sure what they're actually facing. They have no safety awareness at this age. And other than that, they can also fall from playground for older children, toddlers. So what happens is that they may be on the monkey bar and then accidentally lost grip or lost balance and then they fell. Yeah. So falls can happen at home. Falls can also happen in school. And for example, they could be walking from different directions around the corner and then two children bump into each other. This is not uncommon as well. And then they can have a fall, injuries. And what are the intrinsic falls? So this mainly happens to elderly with risk factors. So intrinsic means it happens because of factors related to our body itself. So for elderly, there are mainly three things we are concerned about. Number one could be from what we call postural blood pressure drop, postural hypotension we call it, because when they stand up, the blood pressure actually drops because gravity pulls the blood to the legs, and that's why it can cause giddiness, drop in blood pressure, and that can cause fall. Alright, okay, sorry, just 2 more minutes, finishing up a little bit, and then we come to the questions. Alright, the second more common intrinsic cause of falls for elderly will be fall from, we call it musculoskeletal issues, because as we age, we get weaker knees and we get weaker hips, and our balance also is compromised. As we get older, we also have more health issues like Parkinson's disease, and all these will predispose our risk of falls. Yeah. And thirdly, polypharmacy, because if you look at medication list of the elderly, many times you see that it's a long list, more than 5 medications, and because of that, these medications can actually cause greater risk of blood pressure drop and also greater risk of falls. Alright, so we just talked about the main 2 groups of falls. Intrinsic falls can happen to anyone, so happen to children a lot, elderly can happen as well. And secondly, intrinsic falls, so the main target patients group is actually the elderly because they have risk factors. Alright, let's get to the questions, if you are okay with that. So the first question is, if someone falls and I'm worried they broke a bone or something, should I still move them? Very good question. So if there's any complications happening from falls, mainly 3 things we need to worry about. Number 1, is there any fracture or not? Number 2, is there any internal brain injury or not? Number 3, is there any deep wound causing very, very heavy bleeding or not? So you're touching on a very important question, is there a fracture or not? So if the patient is complaining of pain, or you can see a deformity, a swelling over the long bones, like the legs or the arms, please do not move them. Or if the patient is complaining of very severe pain at the back of the neck or at the back over the spine, please do not move them as well. Call for ambulance, call 995. Because if you move them, the fracture may become worse, and then the bleeding may get worse also. So we're talking about internal bleeding from fractures. Alright, I hope I've answered the question. And we have a question from Instagram. So from Isaka Matthew, the question is, what's the difference between UCC and A&E at a typical hospital? Very good question. So we are having all the good questions today. In our hospital, the urgent care center is actually equipped as a private A&E. The only difference is that in terms of accreditations, staffing, the MOE actually has what we call A&E and UCC lah. So our staffing will fit the criteria of UCC. So private ambulances will come here, but urgent ambulance 995 usually goes to the A&Es like public hospital lah. Yeah. So the usual private hospitals like Mount Elizabeth, they also have similar UCC lah. Yeah. But A&E you will see in public hospitals instead. Yeah. But in terms of managing emergencies and caring for life-threatening situations, falls, we have the capacity to manage, same as the public hospital, and with the advantage that we might be able to act faster because usually we are better equipped with scans and investigations. I hope that answers your question. Alright, so we come to the third question. Okay, my BF means my boyfriend, right? Cut the tip of his finger while cooking and part of the nail is cut in. Oh gosh, I'm so sorry to hear that. So does he need to go urgent care? The answer is yes. Because if part of the nail is cut in, it sounds like the nail bed is injured. However, I hope it's not just the nail tip. Or if there's a nail tip, like cutting a nail, then no lah. But if actually cut into the nail bed with active bleeding, meaning the internal structure of the nail bed is probably injured, please bring the A&E or UCC so that we can help him do a proper wound care, stop the bleeding, and then examine the nail bed, stitch up the laceration if there's any, and then after that we will also do a dressing before letting him go home lah. Alright, okay, so now we are talking about one question. Alright, so it's about the elderly. Alright, how long should we monitor an elderly who falls but seems okay right after before taking them to a doctor? Alright, very good question. Okay, so as I mentioned earlier on, for elderly there are many reasons of falls, and it could be intrinsic, it could be extrinsic, depends on the individual cases. So before going through the question, I want to understand about the past medical history and then the medication that he's on, and whether he has any history of recurrent falls. If he does have falls within the past 6 months, I'll be more concerned because the risk of him having another fall will be high as well lah. While monitoring at home, this may happen again, touch wood, hopefully not lah. But yes, that's the real risk. So if it's actually a second fall within 6 months, I would recommend at least bring him to a GP to assess and understand what's the risk factor. Is it because of postural blood pressure drop causing him to feel giddy? Or is it because of leg issues? Or is it because of low sugar? Or is it because of eye issues? All these can happen. Yeah, so we need to do a proper examination and then decide whether is there anything that we can correct. Yeah. However, there are very minor falls. For example, if the elderly are actually very well, very independent, goes to market park himself, and no fall in the past ever, all right? And he feels very well, and just a very light fall, just like a sleep, and then landed, not too heavily, with no pain after that. So if really that's the case, maybe we still have room to monitor. But in case if the patient has any symptoms or any risk factors, or blood thinners with head injuries, please bring to urgent care center or at least GP to assess. Okay, I hope that answers your question. If not, you can always throw in more questions so that we can clarify. Alright, so we have more joiners. Hi everyone, I'm Dr. Zhu from Urgent Care Center from Alvernia Hospital. Welcome to this live chat. So we're talking about falls and what to do within the first 30 minutes. Okay. While we're waiting for more questions, so maybe we'll talk more about falls in children first, and after that we can go to falls in elderly. So for fall in children, the more common causes we see are number one, fell and then landed on cheeks with chin lacerations. So what do you do in the first 30 minutes? There will be bleeding. So our advice, if you have any cleansing solution at home, clean the wound, and very importantly, take a new gauze, a clean gauze, or a clean towel, press firmly onto the area. Firmly means just apply firm pressure. Do not rub and do not press too lightly because the child is crying. You need to apply enough pressure to stop the bleeding. So most of the cases, the bleeding is actually from venous or from the small capillaries. And if you apply enough pressure, the swelling will be much less. And also, when the swelling is much less, bruising will be much less as well. And when we do the stitching, it will be easier also. So other than that, okay. So the other common falls from children will be fall with head injuries. And if, for example, the child is confused, or if the child is not behaving as per usual with vomiting, or if the child is not really walking, behaving, moving in a symmetrical way, ambulance should be called, because in this case, you might need to do an urgent CT scan. But most of the cases we see in A&E, actually after assessment, the child doesn't need an urgent CT scan. The reason is the brain is still developing, and one CT head will actually equal to about 8 months of baseline radiation. So we try to avoid that. Yeah. Okay, we have a question from Instagram, from Brian. After a child hits the head, what symptoms should parents watch for, and for how long? What should the parents stop when should the parents stop monitoring and seek medical attention? So good, we were actually talking about this question earlier on. Yeah. So a universal rule is that if the child is confused, meaning not talking as per usual or talking about irrelevant stuff, keep repeating the same thing. Or number two, if for example the child is not oriented, looks like unable to concentrate. So these are bad signs. Yeah. The second thing you watch out for is there any sudden new discharge from the noses or from the ears? Because this may suggest a fracture of the base of the skull, and that will be an emergency as well. Yeah. So if this happens, please call 995 or call a private ambulance or bring to A&E immediately, because this will fulfill criteria for urgent CT scan. But other than that, if the child is still okay, there wasn't any abnormal discharge from noses, from the ears, and no loss of consciousness as well, child is behaving as per usual, can bring for an assessment. If it's a minor head injury, for example, we were just sitting here and then suddenly lean backward and then hit very lightly, probably can still monitor the child is still well. But if it's a very, very major impact, falling from 1 meter height, or for example, if a slip and then you hit a very loud start sound, best to bring to A&E for assessment, because we will have to do a full neurological examination, make sure the child is well, make sure the swelling is not too big, before we say that we can monitor. And in terms of monitoring, we can usually monitor for 24 to 48 hours. The most critical is actually the first 24 hours. So you watch out for any kind of confusion, those signs I mentioned earlier. Watch for any new headache, any vomiting, and any abnormal walking, abnormal neurological symptoms. If any of this happens, please bring to A&E also. In general, if the child is okay after 24 hours, usually you can chillax a little bit and then probably just monitor another day. If the child is still okay, in general, can probably slowly resume the usual activities. Okay, here's another question. If an elderly is on blood thinning medication, fell and then is bleeding profusely, what should we do? Okay, so it's always a red flag if the elderly is on blood thinner and then have an accidental fall. the reason is that if he or she is on blood thinner and then had a fall, the bleeding risk is much higher. And we know that the brain is actually a rigid box. So if there's any bleeding, there's very limited space to accommodate the blood. So that can be an emergency, like there's any internal bleeding within the brain. So usually if there's any head injury and then the patient is on blood thinner, we will recommend a CT scan. Yeah. But you will not be able to see the bleeding internally. So if the patient is bleeding profusely, I assume that it's probably bleeding from a cut, it could be from the head, or it could be from any part of the body. Yeah. So firstly, apply firm pressure. Take a clean gauze, clean towel, press firmly down to stop the bleeding. So if the bleeding is actually over a low bone, and then if, for example, there's been a deformity over the legs, please call ambulance as well, because we don't advise to move the patient. In this case, the fracture cannot be ruled out. Yeah. Otherwise, if it's just a wound without signs of fracture, firm pressure is the most important thing to do for at least 10 minutes, 10 to 15 minutes. Do not let go, so that hopefully the swelling will be less profuse. Then once the bleeding has stopped, we can bring to assess to see whether is there any deep cuts that need to be closed. So profuse bleeding doesn't always mean that it's a deep cut. I've seen cases where it's just a superficial wound, but we have to rule out deep cut, because in that case we need to do a stitching. Alright, next question from TikTok user Pew Pew Pew. What are some common first aid mistakes I should avoid? I'm always scared I do the wrong thing. Okay, that's a difficult question. Common mistakes I should avoid. So we're talking about falls, and then okay, let me think about it, because this topic is very broad. Yeah. Alright, so if you are talking about children and talking about a child who just had a fall, and then you want to avoid first aid mistakes. So firstly, for example, just give an example. If the child had a fall and then nose bleeding, started to have nose bleeding, do not ask the child to lean backward. You should always be asking the child to lean forward and then pinch on the soft part of the nose, just below the bony part. Press firmly, do not let go. Because I see parents who tend to, your child's crying, I don't want to press too hard, and then you continue bleed, and then when they come to the hospital, what I hear is the child's bleeding for 10 to 20 minutes already. So I have to do the pressure firmly for 5 to 10 minutes to stop the bleeding. And other than that, lean forward, do not lean backward. Yeah. So I hope that answers the question. If there are any further questions on mistakes on first aid, you can always ask. So next question from Baby Cola on Instagram. Sorry, I hope I read your name correctly. Doctor, my child often has nose bleeding without reason. I don't know, seems like a pretty good questions. Sometimes 3 to 4 times a week. Should I go UCC? Okay, so good question. So nose bleeding, I will also divide it into a trigger and untriggered. For children, who are the children who tend to have nose bleeding? Number one, if they have sinus, allergic rhinitis. So the nasal mucosa tends to be very fragile, and then tends to have a bit swelling. So every time when they sneeze hard, or when they do a bit of nose bleeding without knowing it, you can have bleeding. Yeah. And otherwise, if for example the child doesn't have such risk factors, and just having nose bleeding for no reason, and then it's been there for a few months and 3 to 4 times a week, I think we better do some assessment. Number one, make sure the child is not having a complication from the frequent nose bleeding. Make sure the child is not pale, not having anemia. And if the nose bleeding is heavy, very hard to stop, despite all the first aid done, then we also must make sure there's no blood clotting disorders causing the prolonged bleeding. Yeah. So in this case, usually we do assessment, and then because it's been a few weeks, a few months already, usually we should refer to specialists and do an internal check with the scope, just to make sure everything's okay. Next question. How do I know if I need to go to UCC or just sleep and go to the GP the next morning? Alright, so this is after a fall. I think this is probably with the assumption that after a fall. Alright, so depends on your risk factors. Alright, if you are young and fit, and then it is a minor fall without any pain or without any major swelling, any big wounds, no red flags like headache, vomiting, loss of consciousness, probably can still monitor. But if you are on blood thinner or if having any pain over the long bones or any deep cuts or any major headache, vomiting, feeling not yourself, best see UCC immediately. Yeah. So this is a very broad question, I would say. If you're not sure, call in and then we can try to advise you over the phone because we need to understand your condition a bit better before advise you better. Alright, next question from TikTok. When does one need a tetanus shot for a cut? Can't be for all cuts, right? You are absolutely right. Yeah, it's not for all cuts. So it's more for contaminated wounds. For example, dirty soil, especially if you're overseas. Singapore is very clean, but if it's a rusty cut by a rusty piece of metal, it will be better to get it also lah. So the current tetanus is not just tetanus lah. It also includes vaccination for 2 other bacteria. It's actually good to get it. Yeah, so we advise elderly above 65 and also pregnant patient to get a booster to be better protected. So if you didn't have it in the past 5 years and then the wound looks quite dirty, we will advise you to take again. If you actually has a very clean wound but you didn't have it in the past 10 years, wound looks deep, I will advise to get it if you didn't have it in the past 10 years. Yeah. But if after assessment, the wound is very superficial, very tiny, and it happened from minor mechanisms, not like a very deep incisional injury. And if you're really not keen, we can discuss about that. Yeah, so I do agree with you that not all wound needs a tetanus shot. Yeah. Alright, next question. I remember scraping my knee and going to GP the next morning, but it was already a lot of pus. How to know if a cut or scrape must treat early or just do some first aid at home? Right. Very good question. So sometimes it's very hard to predict how fast the infection will progress. So it sounds like when you scrape your knee, there's probably some breach of the epidermal surface and the bacteria can enter, just that unfortunately the infection spread really fast in this case. So I'm not sure whether it's just a small collection of pus or it's very big pus. So I will advise if there's any open wound, better clean it with the antiseptic solution or at least antibiotic cream lah. If it's looking a bit red, a little bit painful, yeah, because our fingers can be dirty. So it can be really hard to predict. So it's definitely not your fault. Don't feel guilty about it. Because even for myself, I wouldn't predict whether a minor abrasion will develop into a big infection. So we do our best to prevent and watch very carefully. So, but there are circumstances where no matter what we do, the infection can still get worse. In that case, we need antibiotic. Yeah. All right. Next question. Alvernia asks, what should I stock up in my first aid kit for cuts and falls? Very good question. So I think this is useful for everyone. All right. So chlorhexidine solution for cleaning. Some parents, some caregivers prefer iodine as well, but in general, chlorhexidine is sufficient. And clean gauze, unopened clean gauze comes very handy, so you can open and then apply for immediate compression if there's any cuts. And cotton balls, just be a bit careful because when you clean, a small thread, cotton thread can actually be left behind and then make the wound look very dirty. So in general, I prefer gauze, but cotton balls can be used for other purposes as well. For example, cleaning the surrounding of the wound or for cleaning the ear sometimes. So other than that, a bandage will be very helpful so that you can secure the dressing in place. And I do find it helpful to stock at least antibiotic cream at home also so that for minor abrasions and then can at least apply to prevent infection Yeah. So I don't know whether every GP agree with me, but that's my what I do Alright, so okay, we have last 5 minutes. Okay, a Facebook user asks, I always see in movies people will take out the knife and stuck in their leg when they accidentally get stabbed. That's really painful. Is that what we are supposed to do? Okay. No, you should never stuck. Should never struck, right? Shouldn't be stuck, right? I think it should be struck. No, you should never strike the leg with a knife. that's not something advisable lah. No lah. I don't know which movie you watch. Maybe you can share with us the name. I need to find out a bit more details about that. That's not the right direction to go. Please don't. Hi. What if someone coughs for nearly more than a month, breathing, chesty, cough, and phlegm? Could it be bronchitis if a chesty, wheezing, cough nearly a month? Okay, this is the question not relevant to our topic, but I'll try to answer. So, okay, so a month is actually very long, and it sounds like it's been ongoing for more than a month. We do need to assess to see whether the patient has any background of asthma. For example, if it's the hay season, it could trigger asthma attack as well, or whether the patient is a chronic smoker, any history of chronic lung disease, and they can present with recurrent wheezing as well lah. So if none of these groups, even for any adult or any child, if it's cough and then suddenly the child is having wheezing and persistent cough, it can be bronchitis, like what you have rightly asked. Yeah. So bronchitis is acute inflammation of the small airways causing wheezing lah. But I've also seen cases where the parents are suspecting wheezing. We come to A&E, and after we assess, it's actually a different abnormal sound. It could be other kind of noises lah, upper airway noise from nose blockage. Sometimes could be from the vocal cord. So I think better to get assessment. And if it's more than 4 to 6 weeks of cough, you should consider X-ray as well lah. Right. Okay, so I think this is the last question. Alright, so hi, my dad is on blood thinner and he falls and bleeds. What should we do? So, firstly, I will advise you to quickly assess your dad calmly and then also in a safe manner. Try not to move him too much. Ask him, assess whether he's still in his usual self. Any confusion, not sure how he fell, not sure any head injury, let's bring to the hospital immediately lah. But if able to tell you the mechanical fall, I fell, landed on my buttock, I didn't hit my head, and I know the situation very well, I can record everything, and no history of dementia, cognitive issue can be trusted in terms of what it tells you, then probably can assess in a non-urgent manner and check for any pain over the hips, because being elderly, they can have what we call osteoporosis, lower bone densities lah, and this makes the bone very crisp, and then it can actually cause injury very easily lah. So sometimes it may under-report their symptoms lah. If any pain over the hips, do not walk, do not move them, call ambulance and bring to hospital. So that's one thing you need to look out for, any low bone injuries. The second thing we have talked about, any signs of head injury like confusion or any obvious cuts, swelling on the head. If yes, then you apply firm pressure, bring to A&E for CT scan. Thirdly, for profuse bleeding, always use a clean gauze, apply firm pressure to stop the bleeding. Do not take out after 2 minutes and check if it's stopped or not. Just apply firm pressure and then bring to A&E, because he had a head injury and he's a blood thinner. Anyway, he need a CT scan. So just bring to A&E, continue the pressure while all the way here. Okay, this last question. Can you explain the difference between wet healing and dry healing? Very good question. Alright, okay. So our wounds needs a very balanced environment to heal. Cannot be too wet, because if it's too wet, and then you can see that the dressing is constantly wet, and there's a lot of discharge from the wound, can get infection very easily lah. Yeah. And if the wound is too dry, doesn't facilitate the healing, because the cell needs a moist environment to grow, and nutrient also needs a moist environment to move around for the cells to grow lah. So you must maintain a very good balance. So I will just give you one example using abrasion wound over, for example, knees. It's very common, right, after fall. So for the first 1 or 2 days, you will notice that if the wound is deep enough, it tends to have a very clear yellowish discharge, and it's very frequent lah, even if you change dressing. So in this case, I will usually use a dressing that allows better absorption lah, so that it doesn't become too wet. And if you notice, what I always advise my patient is that if you notice the dressing is wet, fully stained away, change immediately. don't wait until the next day because doctor tell you, okay, only come tomorrow lah, don't wait lah. And in terms of when to handling the wound dry, if you notice that, okay, the wound is healing well, maybe initially the wound is already very superficial, just scratches or very superficial abrasion, you can leave it to dry. Or, for example, if the wound initially a bit deep, a bit wet, but after your good care it's already drying up, you can see that it's no longer raw. If you touch, it's no longer, if you touch with a gauze, slightly damp, it's no longer wet. And it's forming a nice granulation tissue over it, you know, like it's probably recovering lah. So you can let it air to dry. Yeah. But of course, if you want to protect your knee area, you can always just put something around it because yeah, there's always risk of accidental injuries. You may, you know, when you are walking, you may bump into something. So if you have a wound over there, it can be a danger lah. So just cover it and protect for another 2 days until it's healing even more firmly, and then you can let it dry heal. Yeah. So I think that's all. Thank you so much everyone for joining us today. Alright, and thank you so much for all the questions. I think they're really helpful for everyone to have better understanding what to do in the first 30 minutes after fall. Alright, I hope that you feel more prepared to handle such emergencies or such cases if it indeed happens, but of course I hope it never happens lah. Alright, so let's see. Okay, so if you have any further questions, feel free to reach out to us over the 3 platforms, Instagram, Facebook, and TikTok. If you missed any part of the session, we'll also share selected highlights on our social media channels. And please do follow us on our socials, Facebook, Instagram, TikTok, to stay informed for all these sessions coming up this year. The next session will be end September on PCOS, polycystic ovarian syndrome. Yeah. Okay, thank you so much. Hope you can all go for lunch now. Thank you.